Today we are going to discuss the fourth lecture of finance in dental care. In the earlier classes, we have discussed regarding the Delta Dental plans and 90th percentile and Blue Cross or Blue Shield Association of the non-profit health services that is been in the finance. In the next, we are going to discuss prepaid group practice. What is meant by prepaid group practice? There is no relation between the group practice and any form of financing, but payment to the dentist is by fee for service or capitation plans. It is the term given to the group practice that provides dental services on the prepaid basis. American Dental Association in 1969 has defined the group practice as a type of practice where dentists and sometimes in association with the members of other professional groups agree formally between themselves or certain central arrangements designed to provide efficient dental health service. It is like saying that it is having a multi-specialty group of practice. What is the definition? As said, as a practice formally organized to provide a dental care through the services of 3 or more dentists using office, space, equipment and or personally jointly. That is, net income in a group is divided equally and paid according to the patient load, years of service and specialty status. What is general practice group composed of? Entirely of general practitioners, single specialty groups and multi-specialty groups. That is, all members of the group are in the same specialty. As I said, multi-specialty groups like certain practitioners in 2 or more specialty fields of practice. That is, having all the groups. Okay, for example, we are having in the dental field as if we have 9 departments. So every specialty has its own thing of doing the practice. So it is of 2 types. It might be a single specialty group or a multi-specialty group in the general practice group. What are the advantages? As I said, it is multi-specialty and can enjoy the vacation leaves. In case of illness, if the dentist is ill, the other people can overtake and do the clinic so that it might not be in a complete closure of the clinics. Quality will improve because built-in peer review, that is especially of the multi-specialty groups, we have a good quality that can be an outcome, and financial benefits like sick leave and pension plans that can plan so that there is a fringe benefits so of easy of doing today economic concerns in dental practice. So it might be a provisions of these types of advantages by having a group practice. What is health maintenance organization? That is HMO. HMO is given as 4 marks question in the previous years. So make sure that it might be a question for the upcoming examinations also. What is the definition? It is a legal entity which provides a prescribed range of health services to each individual who has enrolled in the organization in return for a prepaid, fixed and uniform payments. So it is having 4 principles. What are the 4 principles? They are an organized system of healthcare that accepts the responsibility to provide or otherwise assure the delivery, an agreed upon set of comprehensive health maintenance and treatment services, a voluntarily enrolled group of people in a geographical area is reimbursed through a pre-negotiated and fixed periodic payment made by or on behalf of each person or family enrolled in the plan. That is, these 4 principles should be followed by each and every health maintenance organization. That is, as I said, an organized system. That is, an organized system is a HMO will deal with bringing together directly or arranging for our services by the physicians and other health professionals with the service of inpatient and outpatient facilities for preventive and other care as well as any other health services that are in the defined population which might require reasonably. The system provides continually to the enrolled population through linkages between the components of organizations. And the second one, it is a comprehensive health maintenance and treatment service. The HMO must be capable of providing or organizing for the provision of the health services that population might require, including the primary care, emergency care, hospital care, and rehabilitation. Primary care is one of the keynotes of HMO that emphasizes the services aimed at preventing the onset of illness and disability, at the maintenance of good health, and at a continuing evaluation and management of early complaints, symptoms. Primary care may be that is being graphically described as personal physician care that has an entry point into the system from which referrals to specialists are made. So these are the types of the 4 principles that have been followed. And the third one, as said, it's a voluntarily enrolled group of geographical area. And the fourth one, it is a reimbursed and pre-negotiated and fixed periodic payment. As I said regarding the comprehensive health treatment services, they are being with primary care, emergency care, hospital care, and rehabilitation. Who are being involved in the HMO group? That is, as I said, we have an enrolled group. Members of the HMO are those people who voluntarily join the HMO, that is Health Maintenance Organization, through a contract arrangement in which the enrolled agrees to pay the fixed monthly or other prepaid payment to the HMO. So if they have been agreed and they have a contract agreement, then only the HMO will be authorized. Enrollees agree to use the Health Maintenance Organization as their principal source of health care if they become ill or need care. Different types of dental personnel in HMO. HMO has 4 models, in which the first model is staff model, in which there is a dentist, dental assistants are salaried employees in the staff model. In group models, here the HMO contracts directly with a group practice, partnership or corporation for the provision of dental service. The group concerned receives a regular capitation premium from the HMO, that is Health Maintenance Organization. The payment to the individual dentist is usually not affected by the Health Maintenance Organization contract, though the amount may be. And if the third model is Independent Practice Association, that is the IPA. The IPA is the Independent Practice Association. It is an association of the independent dentists or physicians that develops its own management and fiscal structure for the treatment of patients enrolled in a HMO, that is Health Maintenance Organization. The IPA can also contract with other prepaid agencies such as Delta plans to provide dental services to specific groups on a capitation basis also. So it might be having the independent practice, that is the name itself denotes they can mix up with HMO or they can go with other Delta dental plans so that they have their own purpose of doing the service. The fourth one is primary care capitated network, that is the network is similar to the IPA, that is Independent Practice Association, except that the HMO contracts directly with the individual provider for provision of the service. The provider again is at risk. You can say it might be a risk for the person who might be a primary care capitated network when concerned to the IPA. What is capitation plans? The basis of the capitation plans is that contracting provider, whether an HMO or group practice or IPA or individual dentist, receives an established negotiated sum, that is in a monthly or yearly basis for each eligible patient. The dentist receives the negotiated sum, that is in a monthly or yearly basis. The money is paid regardless of whether the patients utilize the care or not. It is like if you are being enrolled in the capitation plans, definitely the person can get the money in a monthly or yearly basis. Not having the service also, they are being enrolled, they will be given the amount by the HMO or the IPA or the group practice services. In return, the patient is entitled to receive a prescribed set of services over a specified period. That is, the enrollment might be for 1 year or 6 months. Definitely they can provide the service to the patient, or the patient, if it does not utilize also, the money will be paid to the dentist. Capitation fees are fixed monthly or yearly payments paid by the carrier to the dentist for treatment. What is the disadvantages? It might be fear of overutilization. It might be also an effect, because if the person has paid, he might be thoroughly, or he might be continuously visiting the dentist for many reasons. So it might be a overburden or overutilization of services, so that there might be a loss of practice service to the actually needed. And the demand for expensive treatment also might be a factor of the difficulty of the organizations like in the capitation plan. In the capitation plan, salary is one of the thing where the dentist in some group practices, though those in the armed forces and those employed in the public agencies are salaried. The name itself denotes they have been giving the salary. What are the advantages? It allows a dentist to be largely free of business concerns of running practice, thereby allowing the dentist to concentrate on clinical matters. Fringe benefits are also often attractive in the salary. What are the disadvantages? There could be lack of financial incentive because it is a fixed salary, so the salary will be paid in a fixed, so that there might not be a financial incentives that can be provided, or if he has done a good service, also he cannot get the extra amount of money. Some dentists need to be highly productive. Some might be, they might do so many services, they might do implants, they might be doing lasers, they can't do in a salary purpose, because if the salary is not much more, the service that is being rendered by the dentist who has been more productive will be a disadvantage by getting the salary. By this, I am ending this chapter of the 4th lecture, and the next class we will be dealing with the public programs. Thank you.